We'll start with calling the roll.
Sure, Mr. Chairman. Fine.
Here.
Simpson.
Here.
Rosano.
Here.
Cleary.
Here.
Smith.
Here.
Lockhart.
Here.
And McLaughlin, Turley, and Chapman are all excused this evening. 6 present, Mr. Chairman.
Thank you. We'll start with item number 1, previous business, approving the previous meeting minutes. Motion. Second. All in favor?
Aye.
Opposed? Passed unanimous.
Item 2 is tabled pending the public hearing tonight. Item 3 is authorizing an agreement with the Altamont Program Inc. regarding employment services for temporary assistance for needy families and safety net recipients. Commissioner Leclerc?
Good evening. We're requesting approval to enter into an agreement with the Altamont program to provide employment and related services for our temporary assistance clients and for clients, certain clients of the SNAP program, which are the dependents without children, the folks without dependent children. So they help them prepare for employment, prepare resumes, get the training they need, look at how they're going to be able to look for a job, all the rest of that. And that is a contract, we are in the second year of a 5-year contract for this, $429,700 for that contract, primarily federal funding.
Commissioner, do you have any data on how many people who found jobs through the program, number of people who've gone through the program, how many people who found jobs or been helped in other ways?
Yeah, I mean, we're constantly, every year we have to report that to OTDA. So we only follow them we don't follow them for very long though after the program ends. And we have another contract with Pine Ridge that I think came before, or maybe it's coming next month, which will help people, follow people longer
Okay,
after placement.
thank you. Could you send us data
I'll
for
send you
both of
a-
those
yes.
programs?
Mhm.
Thank you. Are there any questions, Ms. Lockhart?
Just to follow up to that, how long do you follow for? Because I'm interested in the retention.
3 months.
Okay, yeah.
Yeah, it's not very long.
How, within that 3 months that you folks do, what is the retention?
I don't know, I'll have to look it up and get that to you. Yeah.
Do you have a feel for it? Is it?
I think long-term, it's not super great.
Yeah. As I had heard, that's why I was curious.
It's tough. People need a lot more support ongoing beyond this placement.
Yeah. Well, thank you. Maybe if you got any numbers,
Yep.
get them to the chairman and back of your question.
Yeah, thank you.
Yeah.
Appreciate that. Are there any other questions? Motion, I'll second. All in favor?
Aye.
Opposed? Passed unanimous.
I have an addendum to this.
Okay.
I didn't know how to present that.
No, but it's all set. You sent a revised cover letter, so it'll be included in the resolution.
That's all I have to do with that. Okay, you got it. Thank you.
Thank you, Commissioner.
Item 4 is amending resolution number 433 for 2022 regarding agreements with foster care providers. Commissioner Manning is here this evening.
Good evening, Chairman Fine and committee members. You know, we actually wanted to expand our opportunities of foster care placements because it is such a challenge to find foster homes, and we, just want to expand. In addition, many of our children have complex needs such as substance abuse or mental health, and a lot of times are rejected by programs due to their behavior or their diagnosis. So we feel that this would give us an opportunity for more placement options for children.
Thank you. Do we have any questions? Motion, second. All in favor?
Aye.
Opposed? That's unanimous.
Item 5 is authorizing an agreement with Berkshire Farm Center and Services for Youth regarding the home run program.
Thank you. Yes, the Home Run program has been operating for several years. I want to say it's close to 10 years. And it's based in Albany City School District and South Colony School District. It's a way to actually have a truancy prevention plan. So they really work with the juveniles who are not attending school and therefore aren't successful in graduation or, a career. So they engage with them and they provide the services and supports that those youth need.
Great, thank you. And how do you identify children to be, students to be part of this program?
It's really in collaboration with the school districts. It's really working with their guidance office, their principals, and who is really not attending school, who's not showing up. And then they'll do a home visit and reach out to the family. A lot of times, especially when you're working with children, parents get frustrated and they can't physically get their child to school. It's okay when they're toddlers, you just pick them up and take them, but when they get middle school and above, it's a challenge.
Great. Do we have any questions from the committee?
Make a motion.
All in favor?
Aye.
Opposed? Passed unanimous.
Item 6 is authorizing an agreement with Cayuga Centers regarding implementation of the multi-system therapy program.
Thank you. Yes, basically Cayuga Center is providing MST, multisystemic therapy, and this is for our juvenile justice population. It's like a 10 to 12 week program, and it's for adolescents 11 to 18 years old. It's really trying to work with the family, work with the youth, in really looking at what is, what are their future thoughts and what do they need to do vocationally, educationally, and they assist them with that.
Thank you. Do we have any questions from the committee? Ms. Lockhart?
Given, Commissioner, I'm kind of curious, since we did start to raise the age, and for this program, how has that been working out for that particular age group, the 16 to 18-year-olds, these kinds of programs? Do you have any?
They do, we do accept, of course, Raise the Age youth. We, ironically, don't have a lot of Raise the Age youth that are coming to our attention. That's why we've expanded to 11 to 18, because originally it was looking at this as an opportunity for Raise the Age.
I thought so. I thought it was
Yes.
the first geared at that, right?
Correct.
Okay,
But
so
then
you're
we
not
weren't
getting
getting the
it.
numbers, so therefore we dropped the age down. And hopefully it be much more preventive and proactive than waiting until they're really involved in juvenile justice.
Now, these, one more question.
Yeah.
Commissioner, now, the younger kids, this is all individualized, right?
Yes,
Okay, that was one of my concerns with the 11-year-olds with the.
With the younger, yes,
You know,
yes.
the older kids, it's just not a good mix.
no, and the learned behaviors, unfortunately.
Thank you, Commissioner.
Thank you. Motion? Second. All in favor?
Aye.
Opposed? Passed unanimous.
Item 7 is authorizing an agreement with Community Maternity Services regarding the provision of clinical prevention services with community and recreational support.
And the clinical programs that we have are really for children that have been involved in the CPS or Child Protective Services, or that they've risen to the attention of needing a prevention referral. We want to keep children in their community, in their home, so this is an intervention that we utilize so we can support the family and so they don't get involved further in the system, either through Child Protective Family Court or the juvenile justice system.
Thank you. Are there any questions?
Do we have any data on success rates?
Yes, I do. Unfortunately, the director of the prevention unit was not in today in the building, so therefore I asked her to get me the data. So she has spreadsheets that will indicate, because they report, all of these agencies report on a monthly basis of the number of children they serve and what goals, again, our performance measures, how are they doing in those areas? So I can get that
All right,
information.
thank you.
Thank you, Commissioner. Any other questions? Motion?
Second.
All in favor?
Aye.
Opposed? Passed unanimous.
Item 8 is authorizing an agreement with Cayuga Centers regarding the provision of the functional family therapy program.
Thank you. Yes, the Functional Family Therapy Program is a evidence-based practice, and it really is looking at children that are at-risk behavior, and again, meaning at-risk, being placed out of the home or involved in the juvenile justice system. So these programs really wrap around services to them to make sure that the children are successful. They actually operate 30 children, in an annual period of time, and it's really, those children are the highest risk that are in foster care placement.
Thank you. Are there any questions? Motion?
Second.
All in favor?
Aye.
Opposed? Passed unanimous.
Item 9 is authorizing an agreement with St. Catherine's Center for Children regarding the Connections Program.
Yes, this is the Connections Program. It was last year that we opened in southern rural Albany County. So, you know, again, St. Catherine's has expanded to that area. It has been serving children in that area, southern rural Albany County, so that includes Ravenna, Queens, Selkirk, Bird Knox, Westerlo. So it really has been effective in looking at those clinical needs of the family, developing a service plan, and meeting those needs.
Thank you. Are there any questions? Ms. Lockhart?
How many families are you serving with this?
They're ages 13 and above and 25 at-risk youth.
Okay. And it's full?
Yes.
Oh, good. Well, not good that the kids need it,
Second.
All in favor?
Aye.
but
Opposed?
yes, it's good we're helping them.
Passed unanimous.
Yes.
Item 10 is authorizing an agreement with Community Maternity Services regarding foster care specialty prevention services.
This one is the specialty prevention. It's working with parents with developmental disabilities. They need a lot of support, and so the community maternity services workers go in the household and really assist with even daily living skills. You know, how do you clean the house? How do you shop? Because those are all factors that really can put a child at risk, as well as a removal for that child if the house is in disarray.
Thank you. Are there any questions? Motion?
Motion. Second.
All in favor?
Aye.
Opposed? Passed unanimous.
Item 11 is authorizing an agreement with St. Anne Institute regarding the juvenile sex offender program.
St. Anne's has been providing sex abuse treatment for years and years and years. They do a great job. But we also, you know, again, the offender needs treatment as well. So this program is specifically designed to be dealing with 10 children, or excuse me, yes, 10 youth and families between the ages of 10 and 18 that have been, offended a juvenile.
Thank you. Are there any questions from the committee?
Can I just
I'm not sure if there's no other.
Yeah.
Okay.
Commissioner, when you say 10 kids, 10 kids from Albany County or 10 kids from the region?
No, it's just, this is Albany County
This is
contract.
Albany County, so we're buying them from the slice of their
Correct.
basket.
Correct. Because we've been monitoring the referrals, throughout the years and feel that that meets the needs. If they, if we needed to go over, I'm sure they would because they are serving other area counties.
Are there any questions? Motion? All in favor?
Aye.
Opposed? Passed unanimous.
Item 12 is authorizing an agreement with St. Catherine's Center for Children regarding foster care specialty prevention services for the parent care program.
Thank you. Yes, St. Catherine's provides the parent care program. It's similar to the CMS program that they're working with parents with developmental disabilities, but they also include parents with mental health challenges. Because we know if a parent is depressed or not meeting their own mental health needs, that family is at higher risk to become involved with the Child Protective Services.
Thank you. Do we have any questions? Motion? Second. All in favor?
Aye.
Opposed? Passed unanimous.
Item 13 is authorizing an agreement with St. Anne Institute regarding the sex abuse prevention program.
Thank you. Yes, St. Anne's also provides sex abuse prevention, and that would be for a family of a victim of sex abuse. Or there may just be sexualized behavior that's being present. A lot of youth can grab people's private parts, and individuals get concerned. Anybody working with the child, either at school or any other community event. So therefore, they still provide 20 families with regular preventive services, but those youth are identified as having some type of sexual behavior if they weren't perpetrated themselves.
Thank you. Mr.
Yeah,
Simpson?
what proportion of the population that needs help gets assistance? In other words, for all of these programs, it seems like there are much more people who have needs do we do it kind of on a triage basis, on an assessment as who's in greatest need, or how do we select?
That's a great question. On a weekly basis, we have a prevention committee that is a multidisciplinary team. So we actually have folks from probation, from mental health, we have our single point of access, we have our early intervention and SPOE, our single point of entry. They all come together, as well as our prevention unit, come together, we look at who has any openings, and then we triage. Who has the highest risk and what else can we put in? Because you can't forget that we also have a youth bureau that has many programs available in Albany County that we don't need to be technically involved. We are because we fund it through our youth bureau, but there's many programs that maybe the family doesn't rise to this level.
Thank you. Are there any other questions? Mr. Smith?
I kind of like what Mert was saying, how do you figure out who needs the most help? Are there any programs in here, we're doing 12, I think 13 tonight, where there's the child or families and multiple? Because a lot of these you can.
Right,
almost all of us.
right, that would be considered double funding.
Right,
We
so-
don't do that.
So
We,
you're not-
unless it is a severe case or a case with, for example, 8 children, and that maybe there's an issue of truancy for the 11-year-old, but then there's, sex abuse on another one. That may be, until that child gets to school on a regular basis, we may double fund that. But we'd have a primary clinical therapist that would be working with the family on therapeutic things.
So one family's not getting like 8 programs?
No.
All right.
No, we don't, we wish we had that
Right.
bountiful services.
Squeaky wheel gets the grease sometimes, so they share.
And I think the other thing is, we really try and connect them, and that's what these agencies are charged with as well, to get them into recreational supports. What's in their community? What's available to them? Is it Big Brothers, Big Sisters? Is it, PAL? Is it, something in the community that they can connect and feel part of their community? Because I think that gives that youth the sense of, I belong.
I'll make a motion.
Motion? Second. All in favor?
Aye.
Opposed? Passed unanimous.
Item 14 is authorizing an agreement with Parsons Child and Family Center regarding the provision of clinical prevention services with community and recreational supports.
And Parsons has been providing our clinical services for years. They do have the expertise not only in foster care, but they also have expertise in mental health related issues. So, and they also actually have a Healthy Families program, which is early intervention. So we are very confident of the services that Parsons provides. And they actually have 75 slots that they are given on a daily basis, if you will.
Do we have any questions? Motion?
Motion.
Motion. Second. All in favor?
Aye.
Opposed? Passed unanimous.
Item 15 is authorizing an agreement with Berkshire Farm Center and Services for Youth regarding the Focus on the Future program.
Thank you. Yes, and this is also another juvenile justice program, and it's for those youth who are really at risk, and really truancy is an issue, and then they drop out of school. We want to see these youth, have some type of positive experience. So they provide education, they provide training, vocational skills, anything that will help boost that youth's self-confidence, as well as make them a productive member of our society.
Thank you. Do we have any questions? Motion?
Motion.
Second.
All in favor?
Aye.
Opposed? Passed unanimous.
Item 16 is authorizing an agreement with Trinity Alliance of the Capital Region, Inc. regarding the provision of clinical prevention services with community and recreational support.
Thank you. Trinity has also been a longstanding clinical provider in our community, and they really have grassroots services right within, really a lot of the south end, but they serve all of Albany County. And we have 80 slots with them for direct preventive services.
Thank you. Could you provide us with some data on the success of this program?
Sure.
Thank you. Do we have any questions from the committee?
Motion.
Motion. Second. All in favor? Opposed? Passed unanimous.
Item 17 is authorizing an agreement with LaSalle School regarding the LaSalle Juvenile Reporting and Family Center.
LaSalle has been providing the Juvenile Reporting Center for several years. It's a juvenile justice prevention service, and it's really keeping those youth off the streets. So after school, they would go there. It's in collaboration with our probation department, and the probation officers are the ones who identify these youth being eligible for the resource center, or I should say Juvenile Reporting Center.
Ms. Locker?
And speaking back to my other question earlier, because I see the demographics is 9 to 17, so this program could capture raise the age kids.
We make sure they're separated.
No, I know you do, but I mean, is this the same thing where you kind of went down and grabbed the 9-year-olds because you weren't getting the raise age?
Correct, because raise the age, unfortunately, oftentimes they're too enmeshed in the system and they're,
Yeah.
kind of.
That's what I assumed, and I didn't know if everybody understood that you're qualifying people in here. They might be too violent, they might be too many, it's too in the criminal justice system.
Right, and the challenge being that, you can't bring a weapon,
Right.
There have been altercations in the program, so we have to keep everyone safe. And the numbers just weren't there, and they can, unless probation mandates them and they get in front of a judge, it's really that they have a choice about attending or not. Or they just, when the van comes, they disappear.
Yeah, I agree with that. I know what kids you're dealing with and what kids raise the age of. And I know that that's a whole different animal.
Yes,
I commend everybody, probation particularly, for trying to do the best they can.
thank you.
Thank you. Are there any other questions? We have a motion? Second. All in favor? Opposed? Passed unanimous.
Item 18 is authorizing an agreement with Cornell Cooperative Extension regarding the provision of juvenile justice prevention services.
Yes, and these are the youth, basically Cornell Cooperative provides a program called Strengthening Families, and we want families that are, involved in the juvenile justice system to go through this program first before a PINS petition or any other thing is filed at probation. We really, in this RFP period of time that we had submitted, we were looking at the younger population to really have an early intervention so parents can learn those skills, because we weren't, again, getting a lot of the referrals on the older side, because a parent would come into probation and say, you need to go through Strengthening Families, then the families opt out, and don't want to be involved. So Strengthening Families is an evidence-based practice, and it really has had positive outcomes in keeping, developing the skills that the parent needs in order to parent.
Ms. Lockhart?
Commissioner, just looking at am I reading this right, where it's aimed at 4 to 10 age demographic involved in the juvenile drug court?
No, not in the juvenile, but also we take referrals from the juvenile drug court.
Because I thought,
I hope they're not involved.
4-year-olds in court, right?
I mean, I've seen some young kids with 4.
No, because this,
Thank you.
we focus this, and that's why I said we focus this RFP on the younger population. We were looking for proposals. So Cornell will do a younger group, Strengthening Families, but also then do the older group.
Okay, great, thanks.
Motion.
Second.
All in favor? Opposed? Passed unanimous.
Item 19 is authorizing an agreement with Cayuga Centers regarding the provision of clinical prevention services with community and recreational supports.
And Cayuga Center is providing an intensive family support. An intensive meaning that the clinical social worker is going out 2 to 3 times per week. We did also, their proposal focused on the younger children as well, basically targeting birth to age 5. However, again, we know that we also have an older population of 10 to 15, 16 that needs this program. So they do provide it really through the age spectrum.
Thank you. Do we have any questions? Motion?
Second.
All in favor? Opposed? Passed unanimous.
And item 20 is authorizing an agreement with the Research Foundation for the University of Albany School of Social Welfare for the provision of management and leadership training.
Thank you. Yes, SUNY Albany has been providing us with training for our supervisory staff. We actually just had one today to talk about teamwork and leadership and how to, if you have a challenging employee, how do you confront them and how do you move past that? And they've been providing on-site training, they do coaching with the new supervisors. And again, with the workforce shortage and not retaining our senior staff, we have used this quite frequently. And the gentleman who presented today is going to provide some technical assistance for those newer employees so they get the skill set they need to become a supervisor.
Great, thank you. Did you have a question? Yeah, it says here that as part of the department's restructuring plan, so are you in an ongoing restructuring plan?
We do. Actually, for this budget cycle, we actually added some new titles and positions, by taking some others and retitling it, so it meets the needs of the department. We're really trying to not have, civil service title of clerk typist 1. There's more things and skill set, and maybe we'll attract more people to come to the county if there is a broader responsibility and, a better pay scale.
Great, and is this a plan that you're going to bring to us for approval? Or-
Yes, it's in the budget.
It's going to be in the budget?
Yes, our
next year?
proposal.
Okay,
Yep, and I can explain it at that meeting.
okay, thank you. Ms. Lockhart?
I heard you say retention and that you're having trouble keeping people, your numbers of staff, I'm talking about staff, you're down on staff?
Caseworkers, yes.
Caseworkers?
Mhm.
And
And
number, how many you're down?
I want to say 20 at this moment in time. But that is across New York State, because I meet with the commissioners in all of the other counties, and this has been a challenge throughout the state. Many of our younger individuals who this is the position, it's an entry-level position, really don't stay a long period of time. They really don't consider the benefits as being beneficial, if you will, and they, I don't like this, I'm just going to leave.
Not an easy job.
No,
Do a lot of them move to the state from the county?
actually, it's funny you should say that. Our Director of Child Welfare left the position to go to another county, and we actually got the state OCFS to take the position. So we have an OCFS worker, so they're going the other way. So that's a positive sign.
Sounds good.
That is, yeah, that's rare.
That is rare.
Is that with parity of salary?
Yes, actually ours is more.
That's interesting. That's
Put
unusual.
that on the calendar.
And she was our regional director, so. It's a win-win for us.
Yeah, that's the end. I was just hoping that, you can get us some numbers, because there's like $5 million of state and county money here, so
Mhm.
I'd just like to know if it was,
Absolutely.
if the programs are working, that's all. On the ones that you can. I'll make a motion.
Motion to, a motion on 20? Second. Second, all in favor? Opposed? Passed unanimous. Thank you, Commissioner. We got a motion to adjourn. Second, all in favor? Opposed? Meeting is adjourned.
But it's pretty good.
Do good work.
Trying to-
Very good report.
Someone asked.